Hello, let's dissect to understand the comment showing so we can understand the follower's experience. This follower reports that since she had her fibroids removed, her hot flashes and menstrual cycle has gone out of control, meaning it's gotten worse since she had that surgical procedure. Fibroid removal is called myomectomy or fibroidectomy. Fibroid can be removed through an open incision, which is called open myomectomy or open fibroidectomy. The other way that your fibroids could be removed is also through laparoscopic procedure, which can be called laparoscopic myomectomy or laparoscopic fibroidectomy. It all depends on how it was done. Laparoscopy simply means that the surgeon went in by making tiny 3 or 2 holes on your abdomen or your stomach, and guided by ultrasound or guided by some diagnostic tool was able to extract that fibroid from your uterus. Whereas the open myomectomy simply means that they cut you open and got the fibroids out. So in both procedures, the womb was disrupted somehow. The reason why we can't, figure out what exactly happened and we're trying to dissect this situation is that there are too many variables involved. People do fibroid removal to preserve their womb so they can have kids. Some people do that to relieve pain or discomfort. Some people do that to decrease the amount of blood when they menstruate. Because when the fibroids bleed, you could have more than 1 or 2 menstruations. It appears that you're having 1 or 2 menstruations in a month or even more, but it could be the fibroid that is bleeding. So some do that to decrease that blood flow so they are not anemic and bleeding too much. On the other hand, when you have fibroid surgery, you put yourself at risk for infection, at risk for bleed, and at risk for other unforeseen conditions. So in this situation, there are several variables involved in the sense that the first variable depends on the skill set of the surgeon. How many surgeries have that surgeon done? And how experienced are they? Are they the ones that go into your womb, get the fibroid out quickly, or are they the ones that go into the womb and have to dig a little bit to figure out what you do? It all depends on their training and their experience on the job. The second variable is your personal health risk factors. Do you have some underlying conditions that makes your womb almost impossible to invade and extract that fibroid out? How was your womb? Do you have chronic conditions like high blood pressure, diabetes, that compromises your immune system? And did you have the fibroid in a location where it was easily removable? And then the third variable is the size and characteristics of that fibroid. Was it just 1, 2, 3? Or was it situated in a place where they could easily extract it? Because there are so many variables in this equation, it will be difficult to figure out why your hot flashes are, profuse, or why your menstrual flow is profuse and making your life, uncomfortable. First, like I said, your own health reasons, personal health reasons that could have factored into the outcome of the surgery. Second is the characteristics of that fibroid that could have contributed to the outcome of the surgery. And third is the skill set of the surgeon. There are so many variables involved, and most times when people go to surgery, they don't come back the same. Something changes in them. And even the fact that your womb was disrupted, let's imagine the womb to be a calm, still water, right? And someone goes in, put an instrument in or dip their hand in, the rippling effect will cause disruption in the womb. So it's possible that when they went in, invaded the womb to take the fibroid out, whether one or two fibroids, I have no idea. That probably had disrupted the work of your womb, or how it works, or it syncs together. Obviously when something is disrupted and doesn't align exactly as it was before the disruption, it causes some dysregulation. So I'm thinking that probably was what happened. And knowing that there are so many variables that could have contributed to this situation, like I elaborated upon, it will be hard to figure out. But my dear, if you have hot flashes bothering you, there are several ways you can handle that. Try and dress in layers. When you get hot, take some of the clothing off. When you get cold, put some of the clothing on. Get a fan to make life comfortable. Get back to the basics. Sleeping right, eating right, exercising, hydrating, taking care of your stress level, and making sure that your health is in top-notch position to handle this menstrual dysregulation and the hot flashes. I hope it's been helpful. I don't know your unique situation that could have contributed. I don't know your surgeon skill set. I have no idea of the type of fibroid, whether it was one that they removed or two, their location. So it's hard to, say anything in concrete, but we're trying to brainstorm, share ideas, troubleshoot, dissect to figure out what may have happened. So I hope this has been helpful. This explanation has been helpful. If you like this video, feel free to share it, like it, follow me, because me and you, we are in this life together. Thanks for watching.